We all have mental health. It is just as important as physical health. The World Health Organization explains mental health as a state of well being in which every individual realizes his or her own potential, can cope up with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with the person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting and are associated with increased disability. They significantly have an impact on daily functioning. It frequently interferes with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with the symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives. Mental disorders among children are desired as serious changes in the way children typically learn, behave, or handle their emotions, causing distress and problems getting through the day. Early diagnosis and appropriate services for children and their families can make a difference in the lives of children with mental health disorders. WHO estimates that half of all these illnesses in mental health started at age 14, and if they go unnoticed and untreated, it can unravel into something much more serious in adulthood. Over 90 million Indians, or 7.5% of the country's population of 1.3 billion, suffer from some form of mental disorder, according to the World Health Organization. Similarly, 2 out of every 10 children suffer from mental health issues. Suicide was the leading cause of deaths among young people aged 15 to 39 in 2016, according to Lancet Global Health Study. Most suicides are related to psychiatric disease, with depression, substance use disorders, and psychosis being the most relevant risk factors. The WHO also observed the 2019 World Mental Health Day with the theme Mental Health Promotion and Suicide Prevention in response to the prevalence of suicide every 40 seconds globally. The WHO also underlines that mental health and well-being are fundamental to quality of life, enabling people to experience life as a meaningful, become creative and active citizens. Mental health correlates positively with the country's economic growth. Five warning signs that a child has mental health problem. As parents, guardians, or teachers, there are some warning signs that can be indicative of mental health disorders, and when caught early, some of these disorders can be treated and dealt with. First, your performance in school. Mental illness have an adverse effect on their academic careers. Mental health disorders can cause a lack of self-esteem, difficulty concentrating, poor performance in reading, writing, and math. frequent absenteeism, repeating grades, and repeated disciplinary problems. Second, drug abuse. Using and abusing drugs and or alcohol, tobacco can make the symptoms of mental health disorders worse and can lead to deterioration of one's health. Third, early depression. Parents should take note and intervene whenever there is child showcases depressive or withdrawn behavior. When parents think they don't seem like themselves anymore, that should be a red light. If the behavior persists for 2 to 3 weeks, it should be brought to the attention of a mental health professional. Fourth, constant worry. Children who are constantly worried all the time might be indicative of an anxiety disorder. At a young age, children should be carefree and worry-free. So, if a child is constantly displaying signs of anxiety, it may be an anxiety disorder. A child who is constantly worrying may be exhibiting early signs of mental health problems. Fifth, bullying. Bullying has become a severe threat to a child's mental health. If a child is bullied, it can severely affect their self-esteem. A child who is bullied may not want to go to school and not even tell their parents or others about it. This can severely affect their mental health and lead them to developing more issues in the future if they do not get the help they need. Early detection and treatment. It is crucial to address the needs of adolescents with defined mental health conditions. It is always better to take help of psychiatrists and psychologists if there are warning signs observed by parents or teachers. Management includes pharmacological judicious use of antipsychotics, mood stabilizers, antidepressants, and non-pharmacological, that is individual psychotherapy, group psychotherapy, and family therapy.